All right, I am just double checking, making sure everything is working here. All right. Let me just double check something here and we will get started. Okay, so today is vitamin D2 day, vitamin D day, November 2nd, vitamin D day. And I'm Dr. Brenda. I'm at New Beginnings Chiropractic in Mount Horeb. And besides chiropractic, vitamin D is one of my favorite things to talk about because I feel like it's just super important. And there's a ton of us that are super deficient. And it's one of those things that I feel like is very critical to overall health and well-being for the entire population, and especially very susceptible groups, and we'll get into some of that. So I just wanted to, in honor of Vitamin D Day, I wanted to get on here and kind of discuss some of the health benefits of vitamin D and answer some questions, talk about dosing, talk about all this different cool stuff, and just really kind of help people understand a little bit more the benefits of it. Obviously, this time of year, it always comes up with cold and flu season and things like that, but I think that you'll see that it's beyond that. So let me just see here. Why is this not changing? All right, so let me move my little picture here. So vitamin D is an essential nutrient and thus a human genetic requirement for healing and prevention. Traditionally, it's been labeled as a fat-soluble vitamin along with A, E, and K, but as we'll kind of talk about in this presentation, it's not really truly a fat-soluble vitamin in the traditional sense that the other ones are. Yes, it can be stored in fat tissue and it does work more effectively when it's taken with some fat, but it actually acts as more of a steroid. It's actually more of a hormone or a pre-hormone. And because of that, and it's used in so many different bodily systems, it, you really have to take a ton of it and have super high blood levels for it to really be stored that way. It's just so important in so many different factors that it really, it gets used up a lot more if you're taking like the optimal amounts. So obviously here it says it's produced in the body in response to exposure to ultraviolet light, which means we get it from the sunshine. That's the natural way that we get it. the most beneficial way that we get it. And so since it cannot be produced in our body without exposure to sunlight, it is an essential nutrient. So even those though that live in sunny climates rarely if ever get enough sun exposure due to clothing and use of sunscreens. So one of my favorite websites in general for finding information, it was traditionally called Vitamin D Council, and it's now vitamindSociety.org. But they've always said that, like, basically in order to get enough, like if you're up in these upper climates, you have to have like basically between 10 a.m. to 2 p.m., May through September, daily dose of skin or of sunshine on your skin with, that means as much skin is exposed as possibly can, and without the use of sunscreen. So obviously that doesn't cover very many people. Even if you live in Florida, let's say, but you work indoors, you're going to be inside during that time period. Yes, there are some people that can get outside on their lunch break, but most people would not be able to get out daily and have as much skin as exposed as possible, and especially without sunscreen. So, and the reason I say May through September too is that even if there's a sunny day in December or January, especially up here in Wisconsin, when are you ever going to be outside with skin exposed in those cold months? So, you know, just sitting and having sunshine on your face might make you feel good, and all these other things have some, you know, mood improving benefits, but it's not going to give you the type of vitamin D levels that you need. So that's why I always encourage people to take it all year long. So a lot of this presentation, I'm going to kind of fly through because a lot of it's going to be just covering different like research articles and things like that on a number of different topics. And since I am doing this live, you can always go back and watch the replay, and I am recording this as well too. So if you ever want to go back, I'll be putting this on our Facebook page and our website and things like that. You can always go back and relook at this information, or if you want to, you know, look up any of these article links and things like that. But I just really want to try to touch on a number of different ways, systems, functions, conditions, however you want to name it, and how important it is, okay? So this is from the Clinical Endocrinology and Metabolism Journal, and well over half, and this was in 2010, and I feel like if anything in the last 10 years, you know, we're not headed in the right direction unless people have been like maybe listening to my posts and, you know, supplementing finally, which is awesome. I love it when people contact me and they're like, I've started implementing this or this for my kids or whatever since I've seen your posts. But well over half the population is severely deficient in vitamin D. That's huge. Research indicates that the vast majority of industrial society is dangerously deficient in vitamin D, and that deficiency is implicated as a causal factor in an alarming number of preventable illnesses and disease-related deaths worldwide. So when people ask me why I'm so passionate about vitamin D, it's not just because like, oh, it might prevent a flu death, or oh, it might prevent seasonal affective disorder in, you know, in the middle of winter in Wisconsin. It's really because we are so chronically deficient, and even at a young age, even in utero, even like women coming in and trying to conceive, we are so inherently deficient that literally almost, I don't want to say almost everything, but there are so many diseases that can be tied back to chronic vitamin D deficiency. And especially because children are outside less than they ever were. I mean, when I was a kid, I did not wear sunscreen. I mean, unless we were going to be on a boat for 10 hours that day and it was crazy hot and sunny, I didn't wear sunscreen. You know, it was, my tan built up, I was outside a lot, vitamin D levels were already high, which protects you from the inside out against sunburn. Like, it was just the natural thing to do. But kids these days are not outside without sunscreen or a UV protective type of swim shirt. And a lot of them aren't outside nearly as many hours as we used to. So, and then you think about too, what was that mother's vitamin D status even before she got pregnant or during pregnancy or while she was breastfeeding, or all of these different things. Like we're taking it back so far that like almost everybody is deficient unless somebody has been actively supplementing. And so when you think about all of these childhood diseases and type 1 diabetes and type 2 diabetes and childhood cancers and autoimmune and allergies and asthma and autism and all these different things, like, wow, is vitamin D deficiency part of that too? And I feel like it is part of that trend. And so, like I said, we're going to cover a whole bunch of different things. But I feel like, and again, this isn't to say that if you have cancer or you have heart disease and you just start taking a vitamin D pill that like it's going to solve all of your problems, but preventatively, I feel like it would solve a ton of problems. So vitamin D plays a role in virtually every human function, including growth and development, brain and nerve function, emotions and behavior. And like with emotions and behavior, I would put in that too, seasonal affective disorder, depression, anxiety, all of that. Maintenance of skin and bones, which is pretty much what we always know. We always talk about vitamin D in terms of like bones and teeth, but regulation and healing and inflammation, cholesterol levels, digestion, heart function, immune function, vision, hormones, and reproduction. I mean, there aren't too many systems that weren't listed here. So you can see how it is so important and how being chronically deficient, especially like from birth or from in utero on, is going to have a huge impact on your quality of life. So it's an essential requirement for proper immune system function, digestive system function, hormones, and vitamin production. In other words, sufficiency of vitamin D is essential for the proper health and function of every cell, tissue, and organ in the body. There really isn't anything that isn't touched by vitamin D. So again, here I'm going to go through a whole bunch of, maybe I should move this down here so we can see those, a whole bunch of different slides just talking about some of these things. And again, I'm not going to read all of the details up here, but if you are interested in going back and getting any of these articles or anything, definitely do so. So sufficient levels of vitamin D are necessary for the proper function of the immune system, for cardiovascular health, for bone growth and repair, and for overall wellness and prevention. Obviously, right now we're in the middle of the COVID pandemic. And so, especially when we're talking about immune system, I want to stress the importance of this, but I also want you to continue to think in the back of your mind, what are the comorbidities that have been really linked to poor outcomes with COVID? Because a lot of those comorbidities are directly related to vitamin D deficiency. What groups or populations have been most kind of targeted and affected by poor COVID outcomes? And that would be African Americans or people with dark skin, and also the elderly. So we're going to talk about some of that as well too. And what do those two groups often have in common? Like a lot of elderly and a lot of African Americans or people of color, darker skin, have a history of comorbidities. So the underlying message weaving all of this together is that, like, if you have better vitamin D levels, it's going to decrease your risk of comorbidities. It's going to improve your quality of life overall. It's going to improve your immune system and all of this other stuff. But it's that interweaving of all of it that makes you stronger and healthier and more adaptable and more able to fight off whether it's an infection or something like that. But if you've got 3 comorbidities going on, your vitamin D levels are sinking, and then an infection comes, it's a lot harder to fight that off. So conditions associated with vitamin D deficiency. So again, we're going to kind of be repeating a lot of this stuff, but cancer, cardiovascular disease, diabetes, and other endocrine disorders or hormone diseases, infections, autoimmune disorders, mental health and learning disorders, musculoskeletal disorders, neurological disorders, including autism and multiple sclerosis, dental caries and periodontal disease, respiratory diseases, skin disorders, and women's health issues such as low fertility and PCOS. So again, that covers a ton of different systems in the body. Symptoms of vitamin D deficiency might be altered moods and or depression, chronic fatigue, chronic pain, weak bones, weight loss, and frequent infections. So I don't know about you, but I feel like a lot of people are stressed, they're depressed, they're tired all the time, they're in chronic pain. I know so many people that have gone through this gamut of trying to figure out what's causing this chronic, dull, insidious pain. And a lot of times they'll get their blood work done and their vitamin D levels are at like 10. nanograms per milliliter. And so we'll talk about where we should be. And oftentimes simply changing their vitamin D dose will improve their pain and their function, which is just incredible to see. So vitamin D deficiency and chronic inflammation. So the active form of vitamin D is a potent modulator of inflammation and may play a role in shutting off chronic inflammatory responses. This is huge. What do we normally take if we're inflamed? Ibuprofen. You know, that's not solving a vitamin D deficiency issue. That's putting a Band-Aid on, you know, and falsely limiting or, you know, trying to limit the amount of inflammation that we have. So if you can shut off a chronic inflammatory response, you can improve huge qualities of your life and of your health and overall function and well-being. So vitamin D deficiency and musculoskeletal pain. So as a chiropractor, obviously, I see a lot of people that are in for chronic pain. And oftentimes too, there's different medications that can decrease vitamin D sufficiency. So that would make you vitamin D deficient. So laxatives, steroids like prednisone, cholesterol-lowering medications, some antibiotics, some anti-cancer medications, some antidepressants. How many people do you know that take one or more of those on a regular basis? And that might be contributing to some of the vitamin D deficiency that they're having, which is also probably going to keep increasing the number of symptoms that they have or the severity of their symptoms that they're having. A lot of times people show up with musculoskeletal pain after they've been newly put on you know, some type of prescription medication, not knowing that it's actually depleting their vitamin D. So here it shows like subjects are treated for 3 months with 5,000 to 10,000 IUs a day of vitamin D3. And there were no episodes of hypercalcemia reported, and the pain symptoms were relieved in 95% of the patients. So hypercalcemia is something that can happen in some individuals if they're taking too much vitamin D. And, but at a safe dose, that very rarely happens unless you have an underlying health issue, which we'll kind of talk about some of those as well too. So another thing here on musculoskeletal pain. So many patients with vitamin D deficiencies may complain of dull, persistent, generalized musculoskeletal aches, pains, and weakness. And again, that sounds like huge, huge, huge part of our general population. I see it all the time. Like everything just hurts, everything just aches. I feel weak. I don't feel as strong as I used to. And again, what are we doing for these people? You know, oftentimes we're just prescribing them or telling them to take ibuprofen or something like that. Another musculoskeletal pain one, experts recommend that vitamin D deficiency should be considered in the differential diagnosis of all patients with chronic musculoskeletal pain, muscle weakness, or fatigue, fibromyalgia, or chronic fatigue syndrome. And again, those diagnoses, especially things like chronic fatigue and fibromyalgia, have the diagnosis have been like increasing with that. And for many people, again, like if you're on a medication, it could be depleting vitamin D and other essential nutrients and things that could be causing you to have some pain. But vitamin D deficiency might also be causing the underlying health issue that might have put you on a medication that might have been depleting it too, which makes it worse. But again, this covers a lot of people in the United States and across the world. Some researchers have found that vitamin D deficiency can occur in up to 85% of chronic musculoskeletal pain cases, especially those involving the lower back. But why are we always jumping to opioids and pain medications? I mean, it's easy. Yeah, I get that. But again, it's not fixing the problem. It's not fixing your vitamin D deficiency. And if anything, it could be making it worse. So cancer is another area where vitamin D deficiency is prevalent. So vitamin D sensitive cancers are responsible for 257,000 deaths, like almost half of all cancer deaths in the United States in 2007. That's huge. So that's something that we know. And again, like cancer doesn't just happen in a day. It takes years to build up. So if we're already starting out our life as a baby or a toddler, vitamin D deficient, you know, you can see how you might start to have signs of cancer. Your body might be doing some things differently because it's not functioning properly at an earlier age, or maybe it's more aggressive and you don't have that vitamin D like buildup to help prevent some of this stuff. So colon cancer could be reduced by 50% with vitamin D levels maintained above 34 nanograms per milliliter. And again, 34 is on the lower end of that normal spectrum. 30 to 35 is kind of like the low cutoff. And I always tell people shoot for like 65 or higher. So this 50% if they're just above 34. But imagine if they were higher than that, that number might just increase substantially. Breast cancer could be reduced by 50% with vitamin D levels maintained above 52 nanograms per milliliter. So here's a really cool chart. I don't think I'm covering anything up over here. So this is disease incidence prevention by serum 25-OHD levels, which is their blood levels. So this black line in the middle here, this is that like 60 to 65 kind of awesome line where I like to see people above. Vitamin D was first kind of on the scene back in the day, like to prevent rickets. So this guy over here. So this 30 range, I mean, that's like, hey, we're trying to prevent a bone disease in children years and years and years and years and years ago. This is where the RDAs were made. This was where all of that stuff was decided upon because they didn't understand all of the other benefits of vitamin D. Look at where all of these cancer type things are, and diabetes and heart attacks and everything. Look where your levels have to really be to just be super awesome. And that's why I'm like, gosh, above 65, if you can get like 75, 80, you know, things like that, like your risks of so many debilitating and long-term health issues just change dramatically. So diabetic neuropathy. A group of type 2 diabetic subjects with chronic painful neuropathy were supplemented with 2,000 IUs a day of vitamin D for 3 months. Symptoms improved from an average of distressing to an average of mild. Overall results were nearly a 50% reduction in pain scores. So that's a pretty big deal. Diabetic neuropathy is extremely painful. And then again, here's just a summary of the health benefits and disease incidence prevention that could be achieved by raising the public's vitamin D levels to 125 nanomoles per milliliter or per liter, which converted to nanograms per milliliter would probably be around 50. So again, 50 is that good range. This is just a little bit different way of presenting it. But look at all of the cancers that are reduced by pretty substantial margins. You know, both diabetes in here, fractures, multiple sclerosis, heart attack, I mean, preeclampsia and C-section, so even related to birth stuff. I mean, this is huge, you know, and we're going to talk a little bit about the pregnancy aspect too and fertility. But vitamin D is a pretty important thing for hormonal health. And again, what runs preconception and conception and the pregnancy and the delivery and that whole, you know, even breastfeeding and all these different things, hormones run that. And if you are like missing important building blocks of hormones, you can bet that your pregnancy and the subsequent health of your child are going to also be affected too. So here's some information on autoimmune issues. Evidence suggests that vitamin D is involved in the triple current childhood epidemic of autism, asthma, and autoimmune diabetes. So again, we're seeing things in children, you know, increasing exponentially. We see a lot of things earlier or things that we never used to see in children. And their rates of everything are skyrocketing. And again, there's a lot of different theories on that, and toxins and birth trauma and all of these different things that make us more susceptible. But at the end of the day, vitamin D might be the thing that makes them stronger to some of the other insults that are happening to their system. So depression and fibromyalgia. One investigation in patients with fibromyalgia syndrome found that pain symptoms and depression and anxiety were strongly associated with insufficient vitamin D. Again, there's so much mental health stuff. And when I look at stress, when I look at depression, when I look at all of these different things that, especially in children, they're just so much more prevalent today as well too, especially coming off of an insanely stressful year and depressing year like 2020, and now we're coming back into the shorter daylight season and all of this stuff, there's no reason that every single person that can be should not be taking optimal vitamin D levels to help with their mental health status. So slowed aging. So there's a lot of aging type stuff too, and we're going to kind of talk about this. But this is just kind of showing like telomeres are a sign of aging or anti-aging, and you want to have nice long telomeres. You don't want to have them like shortening and everything. And when you're deficient, it actually is shortening your lifespan. It's shortening your quality of life. And then so it goes on to say that it underscores the potentially beneficial effects of vitamin D on aging and age-related diseases. So basically, a lot of the diseases that happen during aging, a lot of our slowing down, a lot of our, just feeling older and all of that has to do with these telomeres. And so, if you're exercising and if you're eating healthy, but you don't have high vitamin D levels, you're still going to age faster than somebody with higher vitamin D levels. So this is pretty amazing stuff. Some more information here on insufficiency in older people. So inadequate amounts of vitamin D in older people reduces well-being, aggravates the aging process, in particular reducing mobility, and adds to the severity of osteoporosis and the risk of falls and fragility fractures. It also reduces longevity, increasing the risk of cardiovascular deaths in particular, but may also increase the risk of type 2 diabetes and in certain common cancers, notably colorectal cancer. So mobility is important because the mobility of the spine, especially to freely be mobile and moving, is going to be what allows brain to body communication. It's our nervous system. So if you're starting to be reduced mobility and you're hunched over and you start having fusions and you're locked in there, what do you think that's going to do to the signals between the brain and the nerves and the body and back? It's going to reduce that communication. It's going to aid you and slow you even faster and give even more negative feedback. So this is pretty important stuff there. Physical performance. So a lot of athletes are really into vitamin D because here it says that the right amount of vitamin D will make you faster, stronger, improve your balance and your timing, coordination, all that type of stuff. What athlete doesn't want to be faster and stronger and improving balance and timing? I mean, it's a no-brainer. And again, it's helping with muscle contraction, it's helping with bone health, it's helping with nervous system, brain-body communication. So the faster that you can process some information, the faster your body is going to be as well too. So here's where everything is kind of relevant right now, cold and flu, and then also too, I'm going to share some information about COVID stuff, but in a 3-year trial, taking 800 IUs a day, which is way low, and that even just that little bit of vitamin D reduced incidence of colds and flu by 70%. But in the group taking 2,000 IUs a day, the incidence of colds and flu was reduced by almost 100%. And imagine if you were taking 5 to 10,000, based on your weight and what you needed, if you were taking the actual optimal amounts. And again, knowing how much you're supposed to take oftentimes is related to your blood levels. If you're taking 2,000 IUs a day, but you're at a really awesome blood level, that's great. You don't have to take more. But if you're starting in the teens, 2,000 a day probably isn't going to get you up to 65 very quickly. And so you need to weigh all that out. And sometimes when we get to a really good level, then we can, drop down and take a little bit more and just check frequently. But this is amazing information that even at that small amount, the colds and flus were reduced by that much. But when you upped it to that, almost nobody got sick. This is just another graph showing the placebo. So they were taking something that wasn't vitamin D, obviously, and then just showing the prevalence of how much cold and flu was happening in the wintertime, especially compared to taking this much vitamin D. And then this is just showing the other months as well too. But I mean, that's huge. In a randomized, double-blind, placebo-controlled study published in the American Journal of Clinical Nutrition reported that children taking 1,200 IUs of vitamin D3 supplements daily in winter were 67% less likely to get type A influenza. And again, Some children, based on their weight, might need more than 1,200, but for certain ages of children, 1,200 might be sufficient. So, but look at that, 67%. That's a huge, that is higher than the efficacy of a flu vaccine every year. And so that to me is like, why isn't everybody taking the optimal amount of vitamin D to help prevent all of this stuff? So here's some fertility information. So again, since it does have that hormonal aspect, I feel like for men and women, it's a huge factor in fertility and being able to get pregnant, being able to have a viable pregnancy, but also being able to have a healthy pregnancy and going into delivery stronger, and then also having a better postpartum health and breastfeeding like relationship with your child. So it's not just, oh, I'm just going to take enough vitamin D to get pregnant. I mean, it's literally the entire encompassing from preconception to postpartum and breastfeeding and beyond. And also in that realm, helping with like postpartum depression. Most women, unless again, they're actively supplementing, aren't taking enough vitamin D. And so if you're already going into trying to get pregnant deficient in vitamin D, that's going to cause health issues for you and for your baby. Your body needs to have enough to give to mom and give to baby. So if you're going into pregnancy vitamin D deficient, you can almost guarantee that the baby is going to be born with a suboptimal level of vitamin D as well, which again is why we're starting off already at a poor baseline, because our base of health, because if you are already not giving the baby the building blocks that it needs, it's going to be scrambling. And again, this is why it's important, women with dark skin, to really, really, really make sure that they're getting enough vitamin D, especially prior to conceiving, because their birth journey, their pregnancy journey is already so much more complicated. And vitamin D deficiency is one more thing that's going to completely change that and make it possibly worse and increase risk of preterm and preeclampsia, all of these other aspects. So this one just kind of shows that women with vitamin D intake below, I forgot what EAR stands for, and with their blood levels below what's considered adequate, may be less likely to conceive, and then they could definitely benefit from increased vitamin D to achieve adequacy. So here's some more on healthy pregnancy and birth. So limited vitamin D passes through the breast milk. As a result, many pregnant women and their offspring are very vitamin D deficient. But this should also clarify that if a woman does have enough vitamin D, it will for sure pass through the breast milk. But I think a lot of doctors just assumed, because women were so vitamin D deficient, that breast milk was automatically vitamin D deficient, that therefore all the babies needed to supplement with something. But if the women have, especially coming into pregnancy, throughout the pregnancy, and before entering the breastfeeding period, if they have enough vitamin D that they and the baby can get enough, then milk is usually sufficient. So pregnant women sufficient with vitamin D have lower rates of preterm labor, preeclampsia, and preterm birth, and lower rates of infection. The greatest effects were seen among women taking about 4,000 IUs of vitamin D a day. And then therefore they recommend this daily for all pregnant women. But again, I usually recommend higher, because I find that a lot of it is dependent on the woman's level. If she is at a decent level and she can take 4,000 and it's sufficient for her, that's great. But if she's much below where we really want her to be, I mean, during pregnancy especially, I would say really strive to be at 65 or above, then I would recommend taking more, because again, you want to make sure there's enough for mom, enough for baby, and then enough for breastfeeding. So African Americans at greatest risk of vitamin D deficiency. So it's estimated that 40% of American adults may be vitamin D deficient, but for African Americans, that number could be closer to 76. And then previous studies have shown that African American adults have higher rates of vitamin D deficiency and obesity, as well as lower levels of cardiorespiratory fitness. And then they're generally at risk for a number of chronic and potentially life-shortening conditions, such as hypertension, stroke, insulin resistance, metabolic syndrome, type 2 diabetes, cancer, heart disease, and all-cause mortality, some of those are associated with vitamin D deficiency. So again, what would it look like for an African American child to take optimal amounts of vitamin D throughout their whole entire life prior to getting to adulthood? Would this picture look different? Would that even look even more different if the mother was taking optimal amounts of vitamin D prior to conception, or at least during her pregnancy? I think it has a huge impact. And again, remember that African Americans were one of the, had some of the worst outcomes during this COVID epidemic. A lot of it because of the comorbidities, a lot of those because there is a distinct association with vitamin D deficiency. So vitamin D sufficiency requirements. So again, there's still a lot of variability on this, and it does change. But the first line, achieving adequate levels of vitamin D in most patients without appropriate supplementation could be difficult or impossible. And then once daily multivitamin products contain vitamin D, usually ranging from 400 to 800 IUs, but that would be inadequate for most persons. So a lot of people say, oh, I take a multivitamin, it's got vitamin D, I'm good. Even prenatals, I've seen prenatals, like most of them, are maybe as high as 2,000. So no, if you're taking a multivitamin or a prenatal, you still need to appropriately dose and supplement based on your weight and your age and all of that type of stuff. Because really the 400 to 800 was back in the day to prevent rickets and not for optimal health. So experts recommend, 3,000 to 4,000 IU per day as necessary to create sufficiency. And again, this number keeps changing because a lot of people are like, really, it should be closer 5 to 10, especially if you are down in that under 30 range, and you're really looking to get higher. Like, some of these numbers may just maintain you where you're at, but if you're in a poor place, then it'll maintain you in a poor place. So it really has to be done with understanding your vitamin D supplementation history. What kind of sun exposure do you get? Have you had blood work done? Do you know where you're even starting from? And then kind of dosing as appropriate. So again, restoring the vitamin D sufficiency can take months. And that's another reason why we want to make sure that we're taking the amount that we really need. If you're taking 1,000 to 2,000 a day and you're starting in the teens or the 20s, it's going to take a really long time to even move the needle. And it doesn't mean that you start taking like excessively high amounts either, because you need to find a happy place where you can take an optimal dose and take it for a period of time and then really start to see differences in your quality of health. So this is a brand that we use in the office. Obviously there's pill form, there is liquid form. Liquid form is really awesome for children because you can just mix it right in with water. My daughter just takes drops right in her mouth. So, it's totally fine. And it's in an olive oil base. And then obviously there's some that have vitamin K or K2 with them. There's a number of different types. And I'm going to talk a little bit more here. This is the end of most of the slides, but I just wanted to touch on a couple more things. So especially with the vitamin K. So we need fat to help our body really absorb vitamin D. Most people, I feel like, can take straight up vitamin D and really have a great response. But some people, if it's harder for them to absorb, if you've been taking an adequate dose for a while and nothing is changing with your blood levels, then things that we need to look at are like K2, microbiome, insulin resistance, some other factors that might just really affect your body's ability to absorb it. So vitamin K2, obviously, you can get K through green leafy foods, spinach, kale, all that kind of stuff, Brussels sprouts, broccoli, cauliflower. You can get it from fish, liver, and eggs. Bacteria in our gut actually also convert vitamin K1 to vitamin K2. So what are some things that we can do to make sure that our microbiome is nice and solid and up to par? So obviously, if you've been taking a lot of antibiotics, if you've been taking a lot of prednisone, if you have a poor diet in general where you just aren't, you don't have a very good diverse diet, and especially not a lot of fruits and vegetables and things like that, I think I said antibiotics, but if you've been taking a lot of medications that are decreasing the diversity and quantity and quality of the microbiomes that are in your gut, you're going to also produce a lot less K2 from the bacteria. So eating foods with prebiotics and probiotics, or taking some, some probiotics, making sure that we have a healthy microbiome is going to naturally increase our amount of vitamin K, which is also going to help the vitamin D be more readily absorbed in our body as well too. So like I said, there are some combos that have a vitamin D and K combination together. But if you are somebody that can diligently get it through your food and or making sure that you're taking care of your microbiome, that will definitely help as well too. So there are some situations too where you would not want to take vitamin D, or at least like not without very controlled testing and talking with the doctor. So sarcoidosis, hypercalcemia, hyperparathyroidism are all things that some of those diseases can lead to vitamin D deficiency because it's affecting some different things, but also some of those times, like if you are taking too much vitamin D, it can really impact some stuff. So if you have some underlying health issues like that, like I said, I would definitely recommend talking to your medical doctor and making sure that you're not doing anything that could really put you over the edge. But like I've said, most people that I know take, like most adults can take it easily within the 5,000 to 10,000 range. And again, knowing your blood levels ahead of time is going to be something that's very important. And for children, the vitamin D society.org had always recommended 35 IU per body weight. And then you kind of factor that in, so as they're growing and increasing their body mass and everything, you're changing the dose. And so again, with the liquid, it's nice because you can pretty easily count how much they're getting. One of the other cool things about vitamin D that I don't know a lot of people know is that having higher vitamin D levels protects you internally from like excessive sunburn and things like that. So a lot of times in Wisconsin, when it's like April, May, and it's first few times when it's like nice out and sunny and we're outside and we, get a bad sunburn because we're like, oh, it's April, I'm not wearing sunscreen. Those people that already have like a higher vitamin D level naturally, or because they've been like supplementing, actually have less severe burning. And I just came across another article today that showed that like if you do get a sunburn, taking a high dose of vitamin D afterwards can help minimize the sunburn and improve it and help with skin redness, help with swelling, help with inflammation, help with pain, help with all of that stuff. And so again, I'm not recommending everybody go out and get fried and then just take a whole bunch of vitamin D after the fact, but I'm saying that it has an internally protective mechanism against burning and tanning, or against burning as well. Obviously, the way that we're designed is our skin is supposed to tan and darken, as we've had sun exposure, and the tanning itself is another protective mechanism against getting more sunburn. Now, again, I'm saying this not as saying skin cancer or anything like that. So this is not giving anybody medical advice on how to deal with it. I'm just saying like biologically how we are supposed to handle the sun. So if you're in a situation where, you've already been taking vitamin D all winter, springtime comes, or maybe you go somewhere super hot for spring break and you don't want to just burn and blister the entire time, it's going to offer a protective effect. And I've just always thought that that was really just amazing biologically, that it knows how to do all that. And then, so one of the things that I was going to mention about immune system stuff, so there's been a lot of articles coming around too on who's been having the worst outcomes with COVID. And a lot of that has been low vitamin D, over a certain age, like over 70, and then, dark skin or African American. And they have found that in some of the studies that more than 80% of the hospital COVID patients had vitamin D deficiency. And some of the charts that I saw too, like if they were hovering around 30, if it was like around 20, or if it was like in the teens. So the people that were like teens and 20s had like basically the worst outcomes with this pandemic. So again, it's very important. It's a um, huge booster to the immune system. It helps on all these different levels of the immune system. And so whether it's, just a regular cold or whether it's a novel virus that we've never interacted before, your body's going to have a better chance to fight that off. And then again, if you've had good solid vitamin D levels for a long time, you're hopefully going to reduce your risk of comorbidities that are going to make you more susceptible to a number of things in general. So I think I covered all of my things here. So again, this type of liquid comes, like I said, it's easy to use. It doesn't really have a taste or anything. And it's easy to dose out, especially for children. But there are many high quality vitamin Ds out there. And again, some people, if they need it with the K2, there's definitely some of those. Just want to share this disclaimer that the information presented is not intended to diagnose, treat, cure, or replace standard medical care. It's for informational purposes only, and it's not to be shared, replicated, copied, or used in any way to teach, treat, or diagnose others. So if you have any questions or concern, please, if you have a chiropractor, if you have a different health provider, medical doctor, somebody, but also understand too that everybody has a little bit different comfort level and knowledge base. And if you don't feel like you're getting the right answers, especially if you have chronic health conditions or something going on, don't be afraid to seek out other providers. Or if your provider just won't do a test for some reason, you can order testing kits online, vitamindSociety.org, Dr. Mercola, and usually they're between maybe 50 to 125, so they're not extremely expensive. It's not going to set you back thousands of dollars. It's just like a pinprick finger test. You put some blood on a card, mail it in. And so that's just a really simple, easy way to monitor your own blood levels, especially if there's a situation with insurance where they won't cover it, or I don't know why, but especially with children, there's just a lot of medical doctors that are just really hesitant on doing anything. And so if you're, excuse me, if you're finding that situation, definitely feel free to, order a test online. If you have any questions or anything, feel free to reach out. Like I said, it's just one of these things that I'm super, super, super passionate about, especially being in kind of the birth and prenatal world, because I can see and I understand completely what this world would look like if every single woman and men, because it does help with sperm health and a lot of male fertility issues too, but especially women, if we could get every single woman on optimal levels of vitamin D prior to conceiving, and then just watching that fertility and pregnancy prenatal journey change and making sure that the baby had enough, and then optimizing for birth, for breastfeeding, for postpartum mental health, for healing even after the birth, for all of these things, and then watching that child go through life with the cards in their favor instead of stacked against them, and especially across other populations where darker skin tends to block, summertime, UV production and everything. But I just know that this would be an immensely different place. And also too, if in our nursing homes, or even just if you have aging parents or grandparents, have that conversation. Because I don't feel like enough of our older population is taking enough vitamin D, or any vitamin D. And it is so important, so important. But again, with the stress of this year, the mental health aspects, the immune aspects, the comorbidity aspects, the just everything, people being afraid to even go outside and get fresh air, I know that has decreased a lot of people's ability to have optimal vitamin D levels too. So don't underestimate the importance of vitamin D. And I'm not saying that if you just go out and just start taking vitamin D, that every single one of your problems is going to disappear, but I can guarantee that it's not going to make them worse. So that's my spiel. I hope you guys learned some information, and enjoy your vitamin D day. At least here where we live, it's sunny. So at least, you know, you can pretend like you're out at the beach or something getting some sun. But yeah, I just really wanted to share and go from there. So I'm going to stop this and we'll see you soon.